If you're anything like me, our bodies are being worked on by babies and our husbands. We need to take care of ourselves after the storms to prevent the flood in more ways than one. I am here today with the one and only Jessica Drummond, an international educator on the women's health, as she currently heads the Integrative Women's Health Institute. Stay tuned. Welcome, Jessica. I'm so excited that you're here with us today.
Thanks so much for having me. It's an honor to be here.
Oh my gosh, let's go ahead and introduce you because you have quite an introduction. Dr. Jessica Drummond is a founder of the Integrative Women's Health Institute and is passionate about empowering women who struggle with chronic pelvic pain conditions, hormonal imbalances, female athletes, and supporting women's health and wellness professionals globally. She has 2 decades of experience working with women using physical therapy and functional nutrition and teaching her colleagues from an integrative and evidence-based and conservative perspective. Jessica, we need your help! Especially me as a mom of 4 kids, 10 and under, and 5 actually if you count my husband. What is the most common thing that you are noticing with mothers with young children who struggle from a health perspective?
I think in my practice, obviously I specialize in women's health and hormonal health and pelvic health. So women who have had children most commonly struggle with incontinence, painful sex, sometimes diastasis or just pelvic weakness of the abdomen and the pelvic floor. And overlying it, when you have many children back to back, and even if you just have one, and maybe you also have a busy job, fatigue. I see a lot of fatigue in the women in my practice as well.
Oh, wow. Oh, my God. And we definitely need to take care of our pelvic playground because peeing on yourself is not normal, right, after having a baby?
Right. It's very common to have incontinence, to have pelvic pain, to have back pain even postpartum, but it's not normal. And I think, one thing that we don't do very well that I'm hoping is going to change with the new perspective that just came out from the American College of Obstetrics and Gynecology, the sort of board, the medical board that oversees gynecologists and obstetricians, they just recently announced that they have this new 4th trimester perspective. Now, physical therapists and doulas and midwives and women in general and moms themselves have known that the 4th trimester exists. There is a recovery time that women need after birth. In fact, I used to work at a women's hospital where the hospital delivered approximately 1 baby every hour around the clock. That's 10,000 babies a year.
Oh, wow.
And, many of those women had C-sections, and even if they didn't have C-sections, vaginal birth, sometimes a episiotomy, sometimes a tear. Childbirth, and especially a C-section, is the only major abdominal surgery that people go through where they get no rehab and they're sent home to essentially by themselves take care of a newborn, right?
Oh, absolutely. Oh, my gosh.
So, now in the United States, we're starting to think about that women postpartum need more than just that 6 weeks. Okay, you don't have an infection, nothing's bleeding, you're fine, go back to your life. In France, for at least 10 to 15 years that I've known of, every woman postpartum is seen by a visiting physical therapist for several visits because we've got to get that pelvic floor recovered. We've got to get the abdomen recovered. We've got to talk about different ways to, manage childcare, manage healthy nutrition, manage healthy movement and exercise, and get some sleep during this time when,
Absolutely.
the baby's challenging us as well.
Oh, absolutely. But specifically with mothers when they return to exercise, because I know for me, okay, so the first time I had the first baby, I literally almost had a 4th-degree tear. So I wasn't able to obviously go back to exercise. But by the time I got to the 4th child, I just coughed and it sort of came out, slipped right out. So I was like, oh, I could totally do this again. I could just now can't convince my husband to do so. But we'll get there once. Number 5, yay! No. But the thing is, especially because I know for the special, when you have a child, you're like, okay, time to get back into normalcy, right? And exercise was one of the main pieces for me. So how can we safely get back into exercise, keeping in mind that we need to keep everything down below? Perfect.
Yeah, so we don't want to jump right back into jumping, running, or heavy strength training, because all of those add orders of magnitude of pressure onto the pelvic floor. First thing, certainly if you've had any tearing, certainly a 3rd or 4th degree tear, even a 1st or 2nd degree tear,
So bad.
go and see a pelvic expert physical therapist. You can find them all over the world. And you need to be assessed, because for some women, it takes some time and some healing and some gentle exercise and movement and, breathing. We have to even rethink how we breathe, how we lift. So we're not putting excessive pressure down on the pelvic floor. It becomes essentially a pressure management so that the pelvic floor can heal, and so that we lower our risk for something like a pelvic organ prolapse, like a bladder prolapse or a rectal or a uterine prolapse.
Yeah, no.
And so it's about pressure management. And we don't think about that often before we have children, although there certainly are people who struggle with incontinence and prolapse prior to childbirth. It's much less common unless you are a heavy athlete. If you're adding a lot of pressure, about 80%, for example, of high-level trampolinists do have incontinence. So it's all about this pressure. And if you've been carrying a baby, even if you've had a C-section, there still was, months and months and months of excess pressure on the pelvic floor. So it's about pelvic floor strengthening. You talked briefly about Kegels, but, think about your bicep, right? We wouldn't want to walk around all day long flexing or just, kind of tight, do this a million times a day, right?
Oh, no, that wouldn't work.
You've got to also extend the full muscle. It's got to be able to relax. So when we think about Kegels, it's, pelvic floor muscle straining is really about a whole system of muscles: the lower abdomen, the basket of the pelvic floor, the hips, the low back, and even the diaphragm. And having all of those muscles kind of move in harmony together, and considering the various pressures that moms are going to be under, whether it's lifting their babies or getting back to exercise. And so it's really important to get all of those muscles essentially re-coordinated rather than just kind of going home and doing 3 sets of 10 Kegels, right?
Yeah, exactly. Well, now let's go ahead. Let's shift the focus to my favorite topic. Sex, right? Okay. I really wish somebody educated me on this topic, especially with the dreaded postpartum sex, right? Yeah. Because the thought of anything going up a place that was a site of a war zone or a horror film 6 weeks ago is scary. But I guess it didn't stop me from having more babies. But is it common to have painful sex after postpartum? Or even while you're trying to conceive?
Yeah, so when it comes to postpartum, there's 2 things that happen that make this really common. One, if you did have a tear or an episiotomy, you may have stitches and even just scarring. So, at the vaginal opening, there in the back end where the scars and the stitches may have been. You know, it's a very tender tissue, that vulvar tissue. I kind of think of it as it's as tender as kind of that tissue between your thumb and first finger. And so, you know, you've got to get some time for that tissue and that scar to heal and have more movement. So I actually teach my patients to do some gentle massage using some lubricant, one finger inside the vagina, one finger on the outside, and just gently massaging, you know, any scars you might have from an episiotomy or a tear after they have healed, of course. And then, because many women are nursing postpartum, and even if you're not, it takes a few months for the hormones to kind of go back to pre-pregnancy levels. And so it's normal, especially during postpartum and during breastfeeding, for estrogen levels to be low. So this vulvovaginal tissue here is not only potentially scarred, but there's much less moisture and thickness in the vulvovaginal tissues because of that natural low estrogen state. And so we have to be patient, use a lot of lubricants, think about positioning, you know, slower foreplay, which is challenging when you have a toddler because you're like, I have 15 minutes and then I'm going to fall asleep, right?
Exactly. In and out, fast, let's go.
Right. And so I suggest that, you know, have more and more conversations with your partner about different kinds of sex, different kinds of, you know, slowing down lubrication and arousal and, you know, maybe more oral sex, maybe more different positioning, because then you can get back to healthy intimacy while you're giving your body that time to heal. Absolutely. And then, you know, preconception also, just in general, a lot of women have painful sex relating to many different things, everything from chronic yeast or chronic bacterial vaginosis to vulvodynia, which is a painful vulvar tissue, which can be caused by something as simple as the muscles of the pelvic floor being really tight. So, you know, like I said, that kind of biceps just always flexed, right? The muscles are tight and spasm. Same thing as some women struggle with chronic headaches. If all of the muscles of the neck are kind of where you hold your stress, or there's been any kind of history of trauma or harassment or abuse, these muscles can sometimes carry that in the pelvis. The pelvis is kind of a zone of safety, and it's not always related to a history of abuse or harassment or anything like that, but it can be also just purely physical tightness. Again, especially women who are doing a lot of athletic endeavors, heavy lifting, running, you know, sometimes there can literally be kind of an injury of the muscles of the pelvic floor. So the good news is that depending on the underlying cause of the sexual pain, and it could be more of a complicated diagnosis like endometriosis or vulvodynia or bladder pain, but it could be more muscular related. It could be nutritionally related. People can have pain related to just having something as simple as food sensitivities in some cases.
Oh, absolutely.
So the good news is there, between kind of physical medicine and functional medicine and nutrition, once we get to the root cause, there are so many strategies for significantly reducing that pain. So while it's common, it's not normal, and in almost every case, we can reduce or eliminate that pain.
Oh, awesome, especially for someone who personally struggled from vaginismus for years. So absolutely, everything improved, yay. So therefore, please take in mind what Jessica has to say. And especially as moms, we are completely overwhelmed with everything. And I know that it also affects our libido, right? How do we improve our libido in the midst of all these childbearing years? Because literally that's the last thing on my mind. Especially when you have one kid scream, and then you're right, the time thing doesn't help. And the kids screaming and exhaustion. Like, I want to hit the bed as soon as the kids hit the bed.
It's so true. And, you know, I think it goes back to really that self-nourishment, because it is normal during times postpartum, especially when you're nursing, to have lower estrogen levels and sometimes lower testosterone levels. But stress, so if we have our stress resilient system is strained, so thus our cortisol levels, that's our stress buffering hormone, gets out of balance, then it's almost impossible for our sex hormones to be in balance, which are necessary for libido. And so I think new moms, there are several strategies. Number one, to get your cortisol levels more balanced, it's important to have your blood sugar balance, because cortisol and insulin, essentially balance each other. And so that blood sugar balancing diet, which is, again, challenging to do if you're skipping breakfast and you're driving here and there, get up in the morning, think protein, healthy fats, and fiber, vegetables, the more the better.
Yes,
and we want to do this, consistently throughout the day.
Love it.
Eventually, you won't need to eat more than every 4 to 6 hours. You won't feel hungry. But in the beginning, or if you are breastfeeding, or if you're breastfeeding and you have 3 other kids, you may need to eat smaller meals over time just to keep your blood sugar balanced. So that's key. Second is sleep. We so undervalue sleep, but sleep is essential to your hormones. That's right. So what I tell my clients is we have an 8 p.m. laptop curfew. That means all blue light electronic devices turn off. If you can't turn them off because you have a conference call in Asia, okay, fine, put on some amber glasses and block it out. Or if once a week you have your favorite show and you want to watch it, there are glasses that just have amber tinted lenses that help block out that blue light, which is really helpful for getting the right hormones on board for good quality sleep. And then I also think we underestimate the value of actually getting exposure to nature and daylight during the day. We don't spend enough time outside. So even if it's a cumulative 1 hour, 15 minutes here, 10 minutes there, get your eyes without sunglasses exposed to the natural daylight a few times throughout the day, so your rhythms are more in tune, especially if that baby's waking you up every 3 hours. Your body can really get off when it comes to circadian rhythms. So all of these kinds of self-care things really impact our hormones, and that is really what impacts the libido. But I think the other thing to consider is, I know a lot of really busy moms and working moms. We are terrible at letting anybody do anything for us. So, yeah. And so one of my number one suggestions that I actually learned from a relationship coach who told it to me was, let your husband take you out from time to time. And it may be as simple as hey, we're going to go out I have time next Saturday Saturday night for you to take me out, and let him arrange it, which is super hard for us to let go of. Whatever that might be, let him arrange it. And I think for busy, working, juggling women, sometimes just stepping back and giving up control of something, even for just an hour or two, is really helpful for kind of calming our nervous system. So that's really helpful.
Oh my gosh, I know that works in my household because my husband's responsible for taking us out at least once a month if he wants any action. I'm kidding. No, so it's awesome. Well, thank you so much, Jessica. That was so much fun. And if viewers are as in love with you as I am, how can they get to know more about you? Because I know you have this amazing course also that you can educate even further about these topics. Can you tell us a little bit more about that?
Sure. We have a course called Preparing for Pregnancy, which is helpful if you're struggling with infertility. But I think it's even as important, or as equally as important, for women who have had a baby and are now having their second or third or fourth baby. We need to recover in between before we have the next baby to optimize our own health and to optimize that baby's immune health and reduce a lot of their lifetime risk for things like even asthma and diabetes. So I think preconception care is really important. And if you didn't do it for the first or the second baby, do it for your next baby, because each child depletes some of your nutrients. So that's what our program is about, and they can click on the links along with this video to find it and learn more.
Oh my gosh, thank you so much, Jessica. It's such an honor to spend this time with you today. You guys heard it
Thank you.
straight from the professional's mouth, right? You can't give from an empty cup. So we need to take care of yourself so you can only give to others what pours out into your saucer, right? And to practice your kegels, right? Thank you again for joining me again. Until next time, follow me on social media, HolisticMomMD, and check out my book, The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease, and my upcoming children's book, My Healing Day. Remember, I'm here for you. Let's do this together. Healing is so simple and fun. So, real healing for real life. See you guys again.